Welcome, I'm Vicki. I'm going to talk with you today about what to expect before, during, and after your joint replacement surgery. I'm a registered nurse and I'm the nurse navigator here on the Joint Replacement Center of Excellence. Thank you for choosing Salem Health. Many of our patients have said that a joint replacement has changed their lives. It's improved their lifestyle, increased their mobility, and relieved their pain. As you approach your day of surgery, it is completely normal to feel nervous, have mixed emotions. We want you to know that we are here for you. The purpose of this DVD and resource guide is to help prepare you and your family and to help you achieve your goals. Let's talk a little bit about your healthcare team. You and your hard work are instrumental in the success of your surgery. Understanding and preparing by watching this video or attending class and doing your exercises before and after surgery will give you the confidence and familiarity you need to attain your goals. We include a coaching brochure in your resource guide to help explain the coach's role. We highly recommend that your coach is here with you to participate in all therapy sessions. We try to give you the times of those therapy sessions the night before so that you can better plan your day. It is best if your coach can be with you for the first week after surgery, but the first 48 hours are crucial. An orthopedic surgeon and physician's assistant or nurse practitioner make up your surgical team. They will be involved from the preoperative appointment through your recovery. They work closely to provide you the safest and very best care possible. You will meet your anesthesiologist in pre-surgery, where they will discuss what type of anesthesia they have chosen for you and why. This is the time to ask questions and make sure you are comfortable with their decision before you enter the operating room. You will always have a nurse assigned to you from pre-surgery until you leave the hospital. A certified nursing assistant, or CNA, will also be available to assist you while you are in the Joint Replacement Center. Therapy staff are a very important part of your recovery because they help you to get you up and moving again. As needed, care managers and social workers are available to assist you with obtaining equipment or coordinating care for a short stay at a skilled nursing facility. My role as RN navigator is to navigate you through this process, from preoperative education, checking in with you during your stay, to a follow-up call when you are back home. We want you to have the best experience possible. Please feel free to give me a call or another nurse navigator, a call with any questions or concerns. We can be reached by phone at 503-814-6804 or by email at jointrnnavigators@salemhealth.org. Our office hours are typically Monday through Friday, 7 a.m. to 3:30 p.m. We may not always be in the office, but we will get back to you as soon as possible. Remember, if it is an urgent medical question, please call your surgeon's office. There is someone on call 24 hours a day, 7 days a week to take your questions. In the weeks before your surgery, you will need to do a number of tests. We want to make sure you are in optimal condition for your surgery. So having a current physical exam with your primary care physician is essential. You will also have blood work done and may need an electrocardiogram, also called an EKG, or a chest x-ray. You will also have your nose swabbed to check for staph. Staph is a bacteria. It is prevalent in the community and it can lay dormant in your nose. This does not mean you have an active infection, but it could cause an infection after surgery. If you are found positive, you will be contacted by your surgeon's office and given gel for the insides of your nose. Eating a balanced diet high in fiber and nutrients is important to aid with healing after surgery. We recommend starting a fiber supplement 48 hours before surgery. Any over-the-counter supplement such as FiberCon or Metamucil is fine. Increasing your water intake to the recommended 64 ounces a day is also recommended. The narcotics you will be taking after surgery are highly constipating. And if you add fiber and increase your water intake, hopefully we can keep constipation to a minimum during your recovery. The narcotics can also significantly decrease your appetite. Smaller, frequent meals and healthy snacks will make it easier to get the amount of nutrition you need after surgery. It is also important to have food in your stomach whenever taking your narcotics to help decrease any chance of nausea. There are some medications that your surgeons are going to want you to stop 10 days prior to surgery. Please stop all herbal medications and supplements. These items can cause complications when combined with the new medications you will be on after your surgery. Also stop all anti-inflammatory medications such as Advil, ibuprofen, naproxen, Aleve. These all could increase your bleeding risk at time of surgery. You can continue Tylenol
for pain relief up until day of surgery. It does not have the blood thinning properties as the others. The surgeon will let you know when you are able to resume these medications. If you are currently taking an anticoagulant blood thinning medication such as Coumadin, Lovenox, Xarelto, or even aspirin, please do not stop this medication until you have consulted the surgeon. A plan will need to be made on how you will proceed with these medications to keep you safe.
As we all know, nothing in life comes without risks. Joint replacement surgery is no different. We'll talk about a few risk factors and how to minimize them. We encourage you to talk with your surgeon about any questions or concerns you may have at your preoperative visit. Blood clots are a definite risk. Your surgeon will place you on a blood thinning medication for up to 30 days after surgery. Staying active is very important. To help the blood move through your legs as you are laying or sitting down, compression devices are placed around your calves on both legs and continuously squeeze and release around your legs. We will get you up within 4 hours of arriving to the Joint Replacement Center of Excellence room after surgery. With this early activity, we get the blood flowing and engage the muscles. We will also teach you to perform ankle pumps whenever you are sitting or laying for any length of time. Another risk is infection. Washing our hands is the absolute most important thing we as healthcare staff and you can do to prevent infection. You will also be given 1 to 2 doses of antibiotics in surgery as a precaution. We also ask you to eliminate alcohol and smoking prior to surgery through your recovery time. Both increase your infection risk and slow your healing. Prior to arriving at the hospital, you can also take steps to prevent infection. About 2 weeks before surgery, you can switch out whatever soap you are using in the shower to an antibacterial version. This will help to reduce the general amount of bacteria that live on your skin. You will be given a special cleanser called HibaCleanse. It's an antimicrobial soap. You will receive 3 packets. Please use the first packet 2 nights before surgery, the second the night before surgery, and the third packet the morning of surgery. When bathing with the first packet of HibaCleanse, use a clean washcloth. Wash from the neck down. Avoid the delicate skin areas. Concentrate for 2 to 3 minutes on the surgical area, then rinse really well. Dry off with a clean towel and put on clean pajamas. Repeat the same process with the second packet using a clean washcloth, clean towel, put on clean pajamas, and also get into a freshly laundered bed the night before surgery. All of these things are done to help eliminate bacteria. Get up the morning of surgery and repeat the process. Again, clean washcloth, clean towel, and clean clothes. Please refer to the instruction card included with the soap to review these instructions prior to use. You will have a 4th and final bath at the hospital in pre-surgery. This will be done with HibaCleanse wipes. You will be given instructions on how to use them. The nurse will assist you if you are not able to reach all areas such as your feet or back. Do not shave your legs or use any hair removal products 5 days before surgery. Both can cause micro cuts or burns that can allow bacteria into your system. And lastly, remember, washing our hands is key. You will be going home with either a walker or crutches for about the first 2 weeks after surgery. To provide a safe environment, please pick up any throw rugs or cords in your home. These can be a tripping hazard while using a walker or crutches. You will want to identify a chair that you will use at home. Ideally, the chair will have arms and no wheels, and the height of the seat will come to the top of the bend in your knee or a little higher. You will need to arrange help at home with daily activities such as vacuuming, dishes, mowing the lawn, or walking the dog. These activities should be turned over to someone else for the duration of your recovery. If you can make meals ahead of time and place in the freezer or plan for someone to bring meals to you after your surgery, it'll be easier for you and your coach. Anything you are going to use frequently throughout the day, such as a toothbrush, cell phone, or remote control, should be kept at an easy-to-reach level. This will allow you to grab these items without having to reach up or bend over to get them, which could put you at a risk for falling. We recommend that you install nightlights in the hallways and bathrooms so that your path will be lit and allow you to easily watch for tripping hazards in your path. Pets increase your risk of infection and falling. To protect yourself, always keep a barrier like a blanket between you and your pet. Pets carry bacteria from outdoors or the litter box that can cause an infection. Surgeons will also strongly recommend that you do not sleep with your pet while your incision is healing. Also, make sure that whenever you are going to be up walking around or performing your exercises, that your pet is safely out of the room or in a kennel so that you do not trip on them. Remember, these things are to keep both of you safe. Sometimes it can be the pet that gets hurt and not you. You will get up and dressed in your own clothes the day after surgery. Clothing such as pajama pants, shorts, or sweatpants are great options. Wide-legged pants with an elastic waistband are more comfortable to sleep in and easy to get on. Shoes that slip on with non-skid soles and a back are safest for your recovery. If you prefer tie shoes, please switch out your laces to an elastic shoelace that will convert them to a slip-on shoe. Please make sure the toiletries you pack are fragrance-free. Also, if you would like to bring electronics like an iPad, laptop, or cell phone, we do have free Wi-Fi in the hospital for you to use. Please let us know you have these items in your room so that we can document they are with you. Some people like to bring in personal pillows for added comfort. If so, please bring them in a non-white pillowcase to designate it as your own. Please bring a resource guide to the hospital on your day of surgery. We use this book throughout your stay for exercises, discharge instructions, and more. If you have a walker at home you plan to use, please bring it with you so that the therapist can look it over and ensure that it is a proper, safe fit for you. We have a walker available if you do not have one yet or are unable to bring it on the first day. If you are going to get a walker prior to surgery, we recommend that you get a two-wheeled walker to use after surgery. If you wear a CPAP, please bring in your mask and hose and label them with your name. We use our own machines, so please bring in your settings as well. If you do not know them, you can get them from your primary care physician. And please leave any valuables or jewelry at home.
The hospital will call you a few days before surgery with your arrival time.
Please use the second packet of Hibiclins the night before surgery as directed on the instruction sheet, included with the soap. Make sure to avoid colognes, perfumes, and lotions after the shower. Please do not wear any nail polish or artificial nails on your fingers or makeup the day of surgery. We use an oxygen sensor to monitor your oxygen levels, and this sensor cannot read through any type of nail polish or artificial nail. We do not want any makeup or lotion on your face during surgery.
Also, starting on the day before surgery, the surgeons want you to drink Gatorade to help you stay hydrated. We would like you to drink 32 ounces of any flavored Gatorade the evening before surgery. Then in the morning, drink up to 32 ounces of Gatorade. Please stop drinking as soon as you get into the car to head to the hospital. Please remember, you still must not eat any food after midnight the day before surgery. Doing this could cause your surgery to be canceled. On the morning of surgery, only take the medications you were instructed to take.
Use the third packet of Hibiclin soap and follow the directions on the instruction sheet. When you arrive at the hospital, please park under Building A and take the elevator to the lobby. Then proceed to the east end of the lobby and take the elevators to the second floor of Building A for surgery check-in. Your coach and family can wait in the surgery waiting area on the second floor. The procedure will take from 1 to 2 hours. The surgeon will contact your coach once the procedure is complete and update them. Your coach will know what hospital room number you will be in. It'll be a good time for them to take a walk or get something to eat before meeting you in your room. You will be in the recovery room for approximately 1 to 3 hours after the procedure. Once you are cleared to leave the recovery room, you will be taken to the Joint Replacement Center in Building B, 6 South. Post-surgery, you will gradually have equipment removed as you recover. You may have a bladder catheter. It'll be removed around 6 a.m. the next morning. This will allow your bladder to be emptied throughout the night, but still allow you rest. Compression sleeves will go around your calves to facilitate blood movement and reduce blood clot risk. The pulse oximetry sensor will be on your finger for 24 hours, monitoring your oxygen levels, alerting us if you need supplemental oxygen. The IV placed in your arm in pre-surgery will remain in place until right before you leave the hospital. IV fluids are hooked to this IV in pre-surgery, continuing through the first night, and then are disconnected, leaving only the IV in place. You will receive an incentive spirometer, a breathing tool, after you arrive into your room. The purpose of this is to fully expand your lungs and help prevent pneumonia. Your nurse will show you how to use this after surgery. A gait belt will be around your waist whenever you are getting out of bed or walking. This creates a safety hold for the staff while you are moving to help stabilize you if needed. Whenever you are in bed or a chair, you will have an alarm that will sound if you are attempting to get up or out on your own. The reason for these alarms is to keep you safe from falling and harm. You may have equipment attached to you that could cause you to trip. Please remember to always use your call light for assistance when you need to get up. Managing your pain. Please do not expect to be pain-free. Total joint replacement is a big surgery and you will have some pain. We will work together as a team to manage your pain. Communication is key to successfully managing your pain at a tolerable level. This means your pain is low enough that you can perform your exercises, walk, and sleep without it being too high to do these actions. We use a numerical system for this communication. 0 equals no pain, and 10 is the worst pain you've ever experienced. We will ask you to choose a tolerable level that will be used to help ensure your pain is under control. Please note that we do not always use pain pills as our first response to your pain. If you have been in the chair for a while, we might get you up and back to bed to change your position. We also might apply ice or darken the room. We try to use the most minimal amount of narcotics as possible to help keep the side effects like constipation, nausea, decreased appetite, or fuzzy-headedness to a minimum. Please let us know if what is being done is working or not so that we can provide you with the very best pain relief possible. To go home, you must be able to perform all of these activities safely with minimal help. Walking independently with your walker or crutches, performing your exercises, using stairs for your home, dressing yourself, using the restroom and showering, and getting out of bed or a chair. If you are unable to do any of these items safely, we may suggest a short stay at a rehab facility where you will receive the extra help and therapy needed to help you regain your strength and reduce the chance of falling at home. We will always discuss this with you so that you are aware of our concerns. We do everything in our power to get you back home.
During your hospital stay, you may meet 2 types of therapists, a physical therapist and an occupational therapist. They will help you recover.
The physical therapist gets you up and moving. Your first meeting will be an evaluation in your room. They will go over getting out of bed and performing your exercises. During the second part of your training, the physical therapist will review exercises, walking, and stair training with you. We encourage coaches to be at the therapy sessions so that you can experience hands-on help while still having the support of therapists for questions. This helps ensure everyone is comfortable with their role prior to going home. The occupational therapist teaches you how to do the daily living activities again, such as getting dressed and using the restroom or shower. The morning after surgery, they will get you up, out of bed, and dressed in your own clothing. During the second part of your training, you will have your bathroom safety training, where you will practice getting on and off the toilet and in and out of the shower. We have both a stand-up shower and a tub shower combo so that you are able to practice with the type you have at home. The therapist will use various assistive devices to aid you in safely completing these tasks and will suggest you buy the needed items if you have not already purchased them. Remember, you must be able to walk independently with walker or crutches, perform your exercises, use stairs, dress yourself, use the restroom and shower, and get out of bed before you leave the hospital. Once safe, you may be discharged from the hospital on day 1, 2, or day 3. Keep in mind, surgery is day 0. Once you return home, please take your medication as instructed. Your nurses will provide a medication list that will let you know what medications you are to take and when. Please continue the exercises you learned during your stay. 3 times a day, 10 repetitions of each exercise. Continue walking daily with gradual increases in distance. After you complete your exercises and mobility, it is time to ice and elevate your leg. Elevation should be done 3 times a day, an hour each time. But remember, the more swelling you have, the more ice and elevation you will need to do. Your nurse will demonstrate proper technique before you leave the hospital. Please continue bowel care at home. Pain medication can be highly constipating, so be sure to have stool softeners, laxatives, and even suppositories on hand so that you are able to maintain a more normal bowel function. You will have a dressing in place when you leave the hospital. This dressing is waterproof, so you are able to shower with it on. Be sure to pat it dry after your shower. You will leave your dressing in place for 7 days after it is applied. The date will be listed on your discharge papers. You will receive directions for removal from your nurse at time of discharge. Look at the area around the dressing daily for any changes that could be signs of infection. Things to watch for: a fever over 101 degrees Fahrenheit, abnormal swelling or drainage, or increased redness or warmth. In addition, Increasing pain could be a sign that you overdid it during activity, your pain medication is not effective, or for hip patients, a sign of hip dislocation. Calf pain or swelling in either leg could be a sign of a blood clot. Shortness of breath or chest pain could be a sign of a blood clot in your lungs, which requires quick treatment. If this occurs, do not waste time calling the surgeon's office. Go directly to the nearest emergency room or call 911. With all of these or any other concerns, remember that there's someone on call at your surgeon's office to assist you 24 hours a day, 7 days a week. So what can you do with your new knee or hip? You can resume most normal activities of daily living, plus walking, dancing, biking, swimming, hiking, and golfing. You will want to avoid any high-impact activities such as running, jumping, or jogging. These activities can affect the life of your joint. If you have any questions about certain activities, discuss them with your surgeon. Our goal is to get you back to doing the things you love without the joint pain. We are looking forward to seeing you when you're here with us at the Joint Replacement Center of Excellence at Salem Health.